Okay, so starting with vision, I have my Penlight. And to start with, I want you to just focus on that point across the room. So you see the purple triangle there on the opposite wall. I want you to focus your vision on that. Try not to look directly at the light if you can help it, okay? So I'm going to come just a little bit closer to you here. And we are now beginning with our session. Very mild stimulation to the cornea, the retinas. Brief test for your pupillary constriction and dilation, as well as just overall stimulation of the muscles of the eyes. Focus on that purple triangle. Just keep focusing on the triangle there, Brittany. Very good. You're going to see the triangle change colors. Very good, very good. Okay, all right. And don't pay any attention to what I'm doing. Very good job, Brittany. Okay, all right. Let me just kind of relax for me. So I'm just going to start here. So I'm going to have you just kind of look lazily. You can blink whenever you need to. Just going to shine it in your eyes in every direction. Have a look at normal reactivity to the light. So far, are you feeling any sensitivity here?
A little bit.
A little bit? In both eyes? As I kind of come from the side, just looking for normal response directly in this eye, and then as well as consensual response here, which is intact. Come just between the eyes and look for mutual response, which is intact as well. If I occlude one side, I can test individually here. Just look okay.
Yeah, the right feels weaker.
Does it? Okay. So maybe some slightly delayed response there. So I do want to palpate around your eyes as well. All right. Okay. Let me see. So just performing a brief inspection here of the back of the neck, because you said you were feeling a little bit of tenderness here. So I do find that beneath of the neck is a rather sensitive area. Having a look with my Penlight, I don't see anything of particular concern. Skin is very clear, nice and even. If you look straight ahead for me, I don't want you to follow the light just yet. Just keep your eyes fixated. So I'm going to start here on this side. Just checking for that first independent response, which I do think that looks okay. I don't, maybe a mild delay there. So if I check for consensual response, we do have appropriate constriction and dilation. Okay, so I just want to include one side here. So I want you to tell me if just the pressure behind your eye increases at all with this here versus on this side. Does that feel about the same?
No.
It doesn't. Okay, so I am seeing a little bit just of a delay here on this side. Okay, so have you follow the light now, Cami, so I'm going to move it just like this. I'm going to hold your head, just keep your head still, and we're just going to follow with your eyes. I want you to tell me if it causes any increase in that pressure on this side versus this side.
Yeah, a little bit, yeah.
Okay. And if we go up, does that feel okay?
Everything feels fine there.
And if I go around, does that increase pressure at all? Versus if I go this way?
No, not really.
That's okay. And if I come just out and then all the way in, any pressure there?
A little bit, but nothing uncomfortable.
Okay, all right. I'm just going to start by having a bit of a visual inspection. So I like to start here kind of in line with the neck, and then visualizing just at the ear, looking for any areas of concern there. As I come up towards the temple, I'm looking for any signs of inflammation, anything that looks of particular concern, and then carrying around just at the very base of the hairline. I want to look for any flakiness or any areas of dry skin, redness of the scalp, any signs of hair loss. So I'm just going to turn your head very slightly this way. Having a look at the temporal region on the right side as well. Nothing particularly notable there. Just going to expose the ear. And then as I look at the face and the overall complexion, skin texture, skin color, looking for any signs of sun damage or any dark spots, any patchiness or signs of dermatological concerns. You don't see any flaking or redness anywhere. Skin appears well moisturized, nice and hydrated, cheeks are plump, no signs of active breakouts. Your lips are very well moisturized. It's an area that I tend to see overlooked, and it's here nice and healthy. Got a small brush here. I'm just going to have a look at the brow. I like to look directly at the follicle. Gentle manipulation in the opposite direction, just looking for any signs of sparseness. Particularly at the tail, I do tend to find some breakage of the brow, and that's not notable there. Good. So again, I'm just going to have a look at the other side. So I always like to check for any difference bilaterally, just comparing. Nothing particularly notable here either. Hair is intact. Tail is nice. And then if I look at the lashes on the right side, nice and clean. Signs of excessive oil production of the lash line and no sparseness. Going to follow along the path of the hair that surrounds your forehead, shining my light directly along the follicular line, visualizing any areas of concern. So far, looking for any thinning, any signs of alopecia, hair loss, any pulling at the follicle, place emphasis on the temporal region, as that's where I tend to see areas of traction loss, but so far that's not notable. So coming down onto the forehead, again having a look at the skin. As I come down towards the eyebrow, the brow bone, shining my light directly above the brow bone, checking bilaterally for any signs of edema, inflammation, swelling, any pockets of fluid or areas of irritation. Having a look at the brow itself, so now the hair of the eyebrow, very well groomed, nice and clean. Overall appearance is well kept. Coming down towards the eyelid, looking at the overall texture of the eyelid and eyelashes. Very smooth in texture, not noting any abnormal lumping or bumping, no rigidity as far as I can tell. Shining my light directly over the lashes, I do see several phases of growth, indicates some new growth at the lash line. If I come down below the eyes, having a look at the orbital socket and bone just beneath your eye. So I'm just going to turn your head here slightly, Samantha. That's perfect. And again, having a look at the overall health of the brow, looking for fullness. I will have a closer look at the eyebrows and eyelashes using my otoscope tool, which is just a magnified lighted tool that allows me to have a bit of a closer look. And as I shine my light the center of the forehead, I can see that there is symmetry along the line of the nose. Again, just visualizing at the hairline. So just going to have a look at the ear externally, look for any signs of debris. This side looks okay. You do have 2 active piercings. They appear to have healed nicely. No signs of any flaking or discoloration here. No excess dry skin or cerumen protruding externally from the ear canal. And if I have a look at the other side, again I see 2 piercings. Appear to have healed well. I do see just a little bit of dead skin there around the lower first piercing. And mild dryness of the external ear canal on this side. So there is just a slight bit of asymmetry here in the overall texture of the skin of the ears. Externally, your right ear has just a little bit of flakiness, which is totally normal. It shows a little bit of excess buildup of dead skin cells, which I can clean up for you today. So just something to keep in mind there. Alright, just going to use my light and start up here at the kind of front hairline. Now you said you were noticing some breakage and some shedding. When you notice the shedding, is it like you're just seeing hair on your clothing, or when you're brushing your hair, when you're washing your hair?
I would say when I wash it and when I brush it the most.
Okay. So definitely when you wash it, that is fairly common because, I'll just be careful with your earrings here. Fairly common because when your hair is wet, it's at its weakest state. So obviously just recommend that you're being careful there. Try to avoid brushing it while it's wet if you can. Overall, your hair is very thick, so even if you are experiencing, a little bit of shedding, luckily you've got quite a full head of hair. It does appear as if it's color treated. When is the last time you had it dyed?
About, I would say 4 or 5 months ago.
Okay. And are you taking a break from the color treatments while you're on Accutane?
Yes.
Okay, good.
I do use some heat on it on a pretty regular basis.
Okay. So overall, I would say maybe due for a trim. Your ends are just a little bit dry, but as a whole, I don't notice that there's anything, super concerning happening.
Okay.
Obviously, the Accutane is going to just dry you out kind of overall, and your hair can be affected by that just mildly, but overall, I would say it's in a very healthy state. Now, you said you use heat on it. Is your hair typically a different texture naturally?
Yeah, it's very curly.
Even looking at the more highlighted portions, it still looks very well intact. I don't notice a significant amount of breakage, so that's a good sign. Okay, just gonna have a look at this ear as well. Okay, all right. Just gonna have a look as I shine my light. I'm gonna start on the right side. Test the pupils individually, and your pupils are very reactive. And on the left side. And then if I do a swinging light test, I'm just going to check for consensual and direct response here, which is appropriately reactive. Do you ever have any issues with light sensitivity or and no issues seeing at night while you're driving? Good. So I'm going to bring my light kind of further away here, and if I bring it in close, does that cause you any double vision? Good. And no floaters of your vision, no lights kind of. Good. All right. So now what we're going to do is called a follow the light examination. I will use my same light. I'm going to have you keep your head midline for me, so try not to rotate at the neck. I'd like you to just follow the light with just your eyes, okay? So I'm going to turn here so I have a little bit more range of motion, and if I start here, come to the right side and up, looking for any signs of nystagmus or delay in response. Any discomfort behind your eye as we come towards the outer corner of your visual field? Very good. Okay. All right, Lucy. Starting with the head palpations. Now, you said you're feeling a lot of that tenderness kind of behind your eyes. So I'm going to palpate along the face, along the brow bone, along the eyes, and you can let me know if any of it feels uncomfortable or painful. Okay, thank you. All right. So just relax for me. You're welcome to close your eyes or whatever is more comfortable for you. I'm just going to move your hair here slightly. I'm going to start by feeling around the face and palpate around the temporal region. Just kind of gentle pressure here. Feeling for any abnormal nodules or any areas of pressure.
brow, down into the mandibular joint. Just having a look at the neck. I don't note any swelling here, but I do just want to palpate directly underneath the jaw, along the chin. And I'm going to come down the neck where we have a chain of nodes. Just going to feel here at the clavicle. Any signs of swelling? Sometimes swelling gradually leads down towards the lymph nodes, but it does feel okay. Alright. So, I'm just going to feel along this side as well. I'm just going to move your hair here. And as I palpate this side, I want you to just let me know if there's any pain or tenderness. Not feeling any areas of swelling. Again, no pockets of fluid. Maybe some slight warmth here on the right side. As I come down towards the jaw, again, I'm going to palpate just below the jaw. Down along the TMJ, and then going down again towards the clavicular chain of nodes. Feeling right at the clavicle on the right side, both above and below. And then bilateral palpation, feeling for any abnormalities from one side to the other. That feels okay. Alright. So I'm going to feel along your scalp as well. I want to feel for any areas of tenderness here. So I'm going to palpate directly along the scalp. Don't feel any nodules on the right side. Does any of this cause you any discomfort or pain? No. And if I feel at the base of the scalp, we tend to hold a lot of tension here. I do feel some warmth, actually. Do you have any tenderness here at the base of the scalp? Yeah. A little bit. Is it more so like here on the sides or directly in the middle? Bit of a closer look at that as well. Parting your hair very slightly, feeling directly at the base of the scalp. Don't feel any swelling there. And as I come down directly on the base of the neck, I'm just going to palpate here, coming down along the spine. This allows me to feel for any swelling in between the vertebrae. And if I feel along the shoulders as well, I do feel just a little bit of tension there. Just some tension at the scapular indentation. Maybe some mild edema as well. So overall, this feels like a bit of tension build up at the neck. It could be from the straining you said you were experiencing while looking at the board. Could also be from posture while sitting in the car. Okay. Alright. Just want to feel if there's any kind of pain or any areas of tenderness. So as I palpate just directly along the brow bone, Does that hurt at all? Any discomfort there?
About right there.
Right there. Okay, so mild inflammation here. And if I come down around towards the ear, I'm going to have you just turn slightly here. Any increased pressure here?
I feel it behind my
Do you? Okay. So definitely some here. I actually do feel just a little bit of warmth there still. So I know the ear drops he gave you are prescribed for about another 2 weeks. So definitely want to continue regular use of those. Don't stop them early, even if you start to feel, you know, a little bit better. We want to make sure that you keep using them. And does that still feel down here by the clavicle, or has that improved at all?
It's improved.
It's improved. Okay, good. Very good. Okay. So I'm just going to feel as well with my hands directly against the cranium, feeling for any signs of swelling or any abnormality, any abnormal nodules, any lumps or bumps, sensitive spots, soft spots. I don't feel any signs of swelling. Just kind of flat hand in motion here. Just gonna relax. A very mild pressure. Just going to move into some palpation of the overall head and neck area. So I'm feeling with my fingers, soft circular motions, just palpating along different areas. Directly behind the ear, just like pumping motion here. I'm just going to feel the ears itself, and I will say that your ears are just slightly cold to the touch, so maybe just light lack of circulation here, but certainly nothing I would say is concerning. And as I feel along the jaw, okay, so also checking for any areas of swelling, so palpate along the temporal region. Just let me know if any of this causes you any pain. Come directly along the brow bone. Just very gentle pinching of the brow itself, looking for any signs of inflammation, any pockets of fluid. Good. And then I'm going to touch just very gently directly underneath the eyes. Just keep your eyes closed for me. I know this can be just a little bit ticklish. Directly off the eyelids. Sometimes if there's an excess in sinus pressure, this can feel a bit uncomfortable, so you just let me know. Come and palpate kind of directly along. Just gonna look at the texture of the skin, looking for any textural abnormalities, any roughness, bumping. Overall texture of the skin is very smooth, nice and supple, and very neat throughout. Of course, there's always natural variation, but for the most part, your skin is very healthy. Just going to very gently palpate here at the neckline. Very very soft, flat-handed motion. I'm just feeling very slow. Same thing on the other side. So just feeling around. Feel any abnormality there either.
So I like to start up at the scalp, so I'm just going to feel around. You can let me know if anything feels tender or if it just hurts overall. I'm just feeling for any like lumps or bumps of the scalp itself, and then I will have a look kind of at the hair and at the hair follicle. I just want to begin by feeling around. Not feeling anything so far. I'm just going to palpate just along the hairline. Now I know you said you had a little bit of pressure here. Any pain or discomfort at the temple area?
No.
Okay. I'm just going to feel kind of at the base of the scalp here. Okay. Come around the other side. Nothing at the crown. All of that feels okay. I don't feel any abnormal nodules. Okay. So I'm just going to feel down. So I'm just going to feel down along the neck. You let me know if any of this is tender. Just palpating for any abnormality at the thyroid. Let this feel okay. Okay. Have you had any illnesses recently? Any cold or viruses?
No.
So I'm just going to palpate along the arm while I'm on this side. Just a little bit colder at the arm, but that's okay. Alright, so I'm just going to palpate here at the forearm. Definitely warmer as we come down towards the fingers, which is good. And no pain in your joints. All your fingers feel fairly normal.
Yes.
Okay. All right, so come back to the other side. I just want to feel around this side of the clavicle as well as your throat on this side. Again, just having a look at the forearm, feeling around the wrist. I like to look at the joints. That feels okay. Again, no rigidity here at the fingers. Just out of curiosity, when you do your weighted workouts, do you use a strap or are you just lifting with your hands?
No, I'm just lifting with my hands.
Okay. All right, that looks okay. If you ever feel like you're having too much pressure in your hands, obviously I would recommend that you do start using a weight strap, but I think that looks okay for now. Can just put a little bit of increased pressure at the joint. Okay, so I'm going to start up at the cranium. I will feel around on the back side as well, but I'm going to start here just at the front. So I'm going to feel around the scalp for any areas of concern. Specifically checking for any lumping, any bumps on the cranium, anything abnormal in the skeletal structure. Any signs of swelling, particularly around the temporal region, and then I like to feel back behind the ears, following down that temporal mandibular joint here. And coming down towards your jaw, following along your lymph nodes. I did feel I did see some warmth on my thermometer earlier, so I just want to feel for any signs of inflammation here. So far, nothing notable. So I'm just going to palpate along your brow line here. No signs of inflammation there. I feel just here along the gum line. Okay. So I'm going to come down along the clavicle, feeling along your clavicular region. You have a chain of nodes that runs here just at the chest wall. So just following that down. Come to your upper extremity, filling up the joint at the shoulder. So I'm going to feel at the ulnar bone, just feeling along your elbow. Also going to listen to your pulse while I'm here. Just like to verify that everything matches what our monitor said, and that is appropriate. So I'm also just going to have a look at your arms, looking at the overall skin. You have a couple tattoos. They're all healed nicely. This one is quite beautiful. See just a little bit of discoloration here. Is that a birthmark?
Yeah.
Okay. Good. So a couple freckles. No real signs of sun damage. Skin is nice and smooth. Just having a feel of the texture of the hands. No roughness or callus. Fingers are very well groomed, nice and clean. Just checking for capillary refill, which is very well intact there. And then no signs of rigidity of the hands, which is good. Okay, so I'm going to come and perform the same on the other side. All right, so coming over on the left side, I'm just going to feel here as well, so feeling at the shoulder. Just looking for any signs of rigidity or swelling of the joint. Our shoulders carry a lot of weight throughout the day, so I just like to feel around. Nothing notable there. And again, feeling along the elbow. Just going to check your pulse on this side as well. Very good, nice and strong. So I'm just going to have a look at this side. You have a lot of tattoos. How many do you have?
Maybe like 16.
Oh, wow, okay. All appear to have healed very nicely. I don't see any scabbing or anything. Are all of these fairly older?
Yeah, like 3 years ago.
Okay, so definitely nice and healed. Good. Okay. So again, just having a look at the palm. Nice and smooth.
Checking again for capillary refill. I'm just going to hold down on your finger and then release and watch for appropriate blood flow return, which is typically within 1 to 2 seconds, which is present here, so that's very good. All right, you can go ahead and relax. So I'm going to come around the back, I'm going to palpate around your neck and then your back and see if there's anything there. Sure. Okay? All right, Erica, I don't want to startle you. I'm on the back side of you now. I'm going to start by feeling around at the back of your scalp. So just going to feel again for any abnormalities along the back of the cranium. I find that we tend to hold a lot of tension, specifically at the nape of the neck and towards the back of the scalp. So I'm going to feel here. See if there's anything of concern. Also having a look at your hair. It's nice and thick. No signs of excess shedding. I don't see any shed hairs on the clothing or anything as I kind of move my hands around here. Any tenderness of the scalp at all?
No.
Good. So I'm just going to have a look at your ear, external ears, nice and clean. No signs of discoloration there. So I'm going to come down towards kind of nape of neck, right at the top of the cervical spine. Just feeling along here. So I'm going to come down and I'm going to palpate just right at the spine. So you're going to feel me come right along spinal column. Certainly not feeling any inflammation here, which is good. Okay, so I'm just going to feel along the shoulder as well. Along this side, I'm just feeling for the same thing, just getting a general sense of structure of your back. I don't feel anything of particular concern here. And then if I do some more manual percussing on this side, does that cause you any discomfort? Okay, that looks good. All right. Just go in and do some final gentle palpations of the area as a whole. Just using a flat-handed motion, I just want to feel for any possible concerns I could have missed with my initial exam. So just going to bring that palpation along the upper body. I want to feel at the shoulder for any areas of tension. So we do tend to hold a lot of tension here at the upper body. So I'm just going to apply some gentle pressure. Just a little bit of tightness there. Just apply to increase the pressure. Bilateral pressure just at the clavicular line, so holding at the top and bottom. Circular movements there. I do feel just a little bit of pressure. So just kind of having a look here. directly behind the ears. Some last, I know a few visualizations. Alright, I'd like to go ahead and close out your examination today. Now, I would like to say that as a whole, your body does appear to be fairly well. Now, I did feel some areas of excess tension here just at the shoulder, so I'm not sure if that's more physical stress or if you've had heavier mental load lately, but I do feel just a little bit of overall tension and warmth here. And then maybe some mild pressure build up just below the ears. So obviously recommend trying to get a good night's sleep whenever possible, ensuring that you stay hydrated. Skin is in good health overall. I didn't notice any excess in sun damage or any flakiness of the scalp, any sparseness of the brows. Everything as a whole looked very well. The only recommendation would be to try to reduce stress, which sometimes is easier said than done. Otherwise, I think we can finalize your exam today, and I would like to see you back in the future for a bit of a reassessment.
Thank you so much.
Absolutely. Thank you for coming in. I will allow you a few minutes, and you are welcome to head towards the receptionist just to check out whenever